Hello, and welcome to Attentive Healthcare Solutions, deep dive into NextGen's Patient Experience Platform, Portal. My name is Chelsea Grover, and I'm the Marketing Communications Manager for Attentive. Before we get started on today's webinar, I want to take a moment to explain the process for the presentation. First, I'd like to mention that this webinar will be recorded. We'll send out a copy of the slides along with the recording within the next week. And next, for those of you who aren't familiar with Attentive, I wanted to share a bit of who we are with you. We specialize specifically in NextGen healthcare. We're passionate about providing solutions for our healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. To sum it up, we do everything NextGen. We also have some add-on productivity solutions for NextGen, including ChartGuard, Refund Manager, Unapplied and Deposit Manager, and Multiple Encounter Billing Manager. Next, I wanted to mention some upcoming webinar topics that you can expect for us in June and July. We're going to be covering PCMH certification for NextGen, the basics of APIs in healthcare and what they mean for NextGen clients, and so much more. So keep your eyes out for emails or social media posts on those. Okay, so back to today's webinar on the NextGen PXP. At the end of the presentation, we'll open the floor up to questions from you. We'll answer all the questions at the end, but you can type them in the questions area of the webinar control panel whenever they occur to you. And finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions may be entered in the questions box. So without further delay, I'd like to introduce our presenters for today. Holland Lively is the consultant at Attentive Healthcare Solutions, and Lexi DeMarche is Manager of Consultant Development. They're both subject matter experts on the new PXP. So without further delay, Lexi, let's jump right into it.
All right, thank you, Chelsea. And thank you to all of you for being here today as we're going to take a deeper look at the Patient Experience Platform Patient Portal. So that's a mouthful, so I'm going to be referring to it from here on out as PXP Portal. So with this new PXP Portal, your practice is really going to see the best pieces of that legacy portal that you may have been using previously, combined with some new functionality all in one solution. So before we jump into our actual overview of the PXP portal, I did just want to take a moment to review the patient experience platform as a whole. So just in case you aren't aware, the patient experience platform, it's actually made up of several applications, and they all work together to give patients the ability to access their healthcare data, as well as to be able to interact with your providers and staff in a seamless way. So the first piece of the platform is the reason you're here today, the patient portal. In addition, we also have several add-on features. So those include patient self-scheduling, PreCheck, and NextGen Pay. So we are actually going to be reviewing all of those applications as we kind of walk through and see how they connect to the portal. And then finally, there are two additional applications that I just wanted to mention, NextGen Virtual Visits and NextGen Measure. So those two are also part of our patient experience platform. So now back to our main focus for today's presentation. So this is a sample homepage that a patient would see when they would log into our patient experience platform portal. So we have several features that, depending on your practice setup, you may or may not see. So the first is secure messaging, which allows patients to receive messages from the practice as well as ask questions. We have the ability for appointment scheduling requests. So that would send a request to the practice if a patient would like an appointment. We also have our patient self-scheduling feature, and so that will allow the appointment to be scheduled directly on the appointment book itself. We have the ability for patients to submit prescription refill requests as well. We have our bill pay feature, so a patient can see balances as well as make payments. We have our health forms. So those health forms allow patients to complete some data and then that's submitted back to your practice before they actually arrive for the appointment. And then finally, the health record. So that health record is going to be that summary document. We'll see an example of that when we get to that section. Okay, so now back to the patient portal. So we're going to start by reviewing some of your practice's options for configuring the portal and exactly how we can do that. So there are several locations that your practice can go to complete the configuration of the PXP portal. So after that initial configuration that your practice is going to be guided through, these configuration tools can be used to make some minor tweaks down the road as needed, as well as being able to access some of the patient activity and kind of report on that in your system. So the first tool is one that is typically only accessed by users in more of like an administrative role, and that's our site generator. So really that site generator is going to be the main tool to allow you to enable features that you're going to be using in the portal, as well as there are some configuration settings. The second tool is the PXP integration tool. So this is a web tool as well that contains several settings that really allow you to integrate that patient experience platform portal to your NextGen environment. We'll also see in some later slides that this tool can also be used to review data that was submitted by a patient. There are also a few system master files that we'll find in file maintenance for configuration. So these master files, they do contain less settings than we would have seen with the legacy portal, but we will see how a few of these can be used in some of the later slides. So in addition to those tools on the previous slide, we also have the practice portal. So this is a web tool that's typically a little more widely used. So less just by someone who's like an administrative role and by more users in the practice. So this allows you to do things like viewing and managing portal enrollment, as well as if you do use the online patient or payment feature, you'll be able to see that data here in the practice portal. Another web tool that can be used by typically many users in the practice is the appointment dashboard. So this dashboard allows viewing of appointments as well as the data related to things like PreCheck and notifications that are sent out to patients as well as reminders. And then finally, if your practice does choose to implement the patient self-scheduling feature, there is a separate web tool for that, and that allows you to configure some of the settings specific to that feature. So I know that is a lot of different locations for configuration. I don't want to overwhelm anyone. I just want to put in one place where you can go to reference. But really, as I mentioned, your organization is going to be guided to that initial setup. So a lot of the configuration will be done. And then some of these tools like Site Generator, for example, you may only access it every once in a while, just when changes need to be made. So once you have gone through your configuration, you have the PXP portal, to suit the needs of your practice, you can really begin to use all of the features that can really benefit you as well as your patient population. So now let's start by reviewing some of those features. So the first feature that we'll review is secure messaging. So this secure messaging feature, it really mimics pretty closely to what we had previously in the legacy portal. So this is going to allow patients to compose messages as well as receive messages, from different users or work groups, from both, clinical, billing staff, however your practice chooses to use it. We do have message routing groups. So again, those are going to kind of mimic what we had in the legacy portal. And really those will be able to help guide patients in the selection of really who their message should be sent to. Like you can see in this example, we have a group for Ask Billing and one for Ask a Provider. So message labels are created to help guide the patients when they're selecting who really their message should be going to. So those labels are created in Site Generator under the Ask a Staff category. So here we have the ability to name our labels. We can even associate a fee if there is a cost to submitting a message, as well as set up some permissions of who has the ability to see those message labels. So once your practice has created all of the message labels that are needed, the next step would be to create those message routing rules. So those message routing rules are configured to, kind of like we saw with the legacy portal, really route those messages to the correct, either user or work group that should be responding. So our message routing rules are created in our PXP integration tool. So you have the ability to set up a default rule, and that will just kind of serve as a catch-all if any message labels aren't assigned, to a specific location or user. So in that case, the message would still be sent to whoever you choose. Maybe you have a supervisor or practice manager who is in that role, and then could reassign those messages as needed. And then any additional routing groups for each specific message label can be created. So these groups can be specific to a location, as well as specific to a provider as needed. For example, maybe each provider at your practice has a nurse or an MA. They typically works with them. So you can actually create different groups for each provider. Also, as part of this setup, you can create an alias, and that alias would basically just be used if a user is responding to a message that was sent to that particular group. So, instead of saying, seeing the user's name, they would say, maybe your practice, and it would say nursing or a provider's name. Once those routing groups are created, then you can assign them to either individual users who would be responsible for those messages. We can set up user groups, which are kind of similar to work groups, or we can even use security groups from system administrator. So, for example, if you have a security group of nurses, you could assign that entire group to a certain message label. In addition to those message routing rules, online profiles can also be created. So our online profiles in the PXP portal are really going to have the same functionality as we saw in the legacy portal. So they are essentially used to create an alias that will be visible to patients, either when messages are being sent out of the practice or when they are being replied to from a patient. So our online profiles, they kind of have a similar setup to our message routing rules. The difference is that these profiles are used when the message or response is originating from the practice. So essentially similar setup, you would give a name to that alias, so that would be what the patient would see. And then you could assign, again, either individual users, task work groups, or security groups as well. So practices will have the ability to view, compose, and manage those patient messages. And that will take place on the patient portal tab of the inbox in the EHR, as well as the mailbox in practice management. So on this patient portal tab, users will have the ability to compose a new message. They could reply to a message that was received, reassign a message to a different user, forward a message, add a message to the patient's chart. So if you'd like that to be, within the chart itself under an encounter, as well as they can send tasks from these messages. The PXP portal also has several options available to patients for scheduling appointments. So the first option is appointment requests. So this feature is what comes out of the box with the portal, and that allows a patient to complete a form basically requesting an appointment, and then that's reviewed by practice staff, and then they would go ahead and actually schedule that appointment. So the patient will start by selecting their desired location and provider. So the patient will first see a list of providers they have previously seen, if they have seen providers at the practice, or there'll also be a search option. So they could search to find a provider either by the provider name or the location. Once that location and the provider have been selected, the patient can either request just the first available time, so if they don't really have a preference, or they can set up their preferences. So for things like a certain time of the day, days of the week, whether it be this week, next week. And then finally, the patient would complete that reason for visit box. And then that will just be sent along with the request, so staff have the ability to select the correct appointment time for this visit. Once that appointment request has been submitted by the patient, the details of that request can be reviewed on that patient portal tab of the EHR inbox or in the mailbox in practice management. So from that appointment request message, users have the ability to go ahead and actually schedule that appointment by selecting that schedule appointment button. That's going to launch our appointment search ahead window. And then the criteria from that request can be entered, and then an appointment that's available would be found, that meets the patient's needs. We also have the ability in the PXP portal to allow patients to self-schedule. So this feature basically allows a patient to select the exact appointment date and time, and then it's actually scheduled and added directly to the appointment book without needing oversight by the practice. I do want to point out that this feature is an add-on to the base portal, so this is something additional. So appointments that are made using self-scheduling will have the letters PSS in the appointment details section, as well as there are several options for reporting on these appointments. So I know, one of the common questions I get is, if they just end up on the appointment book, how can we track them? So those are, a few of the ways is to run a report or create a task as well. So the practice will have control over, which appointment types, providers, and locations are available to be self-scheduled. So it doesn't have to be a free-for-all. You have the ability to kind of lock down, whether it's, if you're going to allow new patients to self-schedule or not, if certain providers don't want to participate or certain appointments really need to be, scheduled with the practice, that's an option as well. We also have an option to allow self-scheduling through a link, and that's going to allow patients to schedule an appointment without having to first log into their portal account. So the configuration for this feature takes place in what's referred to as the patient self-scheduling admin tool. So you can actually find a shortcut for this tool in Site Generator. So that's a little tip for the PXP portal, is a lot of the configuration and links you can find shortcuts to in Site Generator. So that's always my recommendation to start there. So there are numerous settings for self-scheduling, and like I said, really a practice can customize the experience to suit their own providers as well as locations. So one of the first features is you do have the ability to enable Spanish. With the Spanish language enabled throughout the scheduling process, different prompts and different dialog boxes will be available in both English and Spanish, just depending on your patient population. Practices can also use this tool to define the order of screens that the patient will see when selecting an appointment. So our options are location, resource, appointment type, and specialty. So you can have multiple variations of these rules if you want to give the patient a choice of where to start. For example, one patient, maybe can decide to select a particular provider first, and then they would move on to maybe choose a location, appointment type, whereas another patient may not care which provider they see, so they may start by selecting the location and then see which providers are available at that location. We also have the ability to set up announcements that would go throughout our patient self-scheduling workflow. So these can be customized for the practice, and then they will be displayed in different areas for the patient. So our message options are kind of broken down into 4 main categories. So we have greetings, cancellation policy, demographic page instructions, as well as insurance instructions. I mentioned these kind of show throughout the scheduling process, where appropriate. For example, greetings that will display when a patient first logs in. And some examples that I've seen practices use is maybe you have a line that says, for emergencies, please call 911, or maybe you're not allowing new patients to schedule, so maybe it says, if you're a new patient, please call the office to schedule. So that's an example of some of those announcements that you can have throughout your site. We can also use this patient self-scheduling admin tool to configure the display options for the patient's appointments on the patient self-scheduling tool. So our patient history settings, they are set up to determine whether new patients will be allowed to self-schedule. So it's going to look at the number of months since the patient was last seen at the practice. So, for example, you could set it for 36 months, if your practice's policy is that, a patient is considered new after 3 years. A practice can also set a lead time for rescheduling or canceling appointments. Maybe, for example, that lead time is 24 hours. So that is going to prevent, any kind of last minute changes to appointments that you don't have the ability, to quickly oversee. Settings are also available for how resources will display for patients when scheduling. So for example, you can upload provider images. So that will show to help patients maybe identify their provider, as well as there's an option for the last seen indicator. So that last seen indicator basically is just determined by the most recent appointment that was marked as kept within the practice. So you can select that, again, just kind of maybe help patients identify the provider they last saw if they want to see them again. Another feature that can be customized for patient self-scheduling is the use of what are called decision trees. So decision trees are basically just a series of questions that can be configured to prompt the system to select the correct event type based on the patient's responses. So the decision trees are optional, but if your practice chooses to use them, they'd be used basically in place of the patient going through a list of appointment types and trying to determine which one they need. So in the patient self-scheduling admin tool, the decision trees are set up as what they call categories. So these categories can be created in both English and Spanish, depending again on your practice's patient population and your setup. We can also configure these categories to be specialty specific. So each branch of our decision tree basically can have one of 3 options. The first is what's referred to as a message. So this message essentially provides a hard stop for scheduling. So instead of being taken to an appointment type to go ahead and submit that, it'll actually give them a message that explains why the scheduling stops. So typically it's for an appointment type that you would rather the patient calls the office for, or other criteria aren't met. So you can have that as a message so the patient can choose then to stop and call the practice. Another option is a question. So this basically continues to prompt the patient to answer the question to get closer to selecting that appropriate appointment type. And then the final option, which is obviously the end goal of this decision tree, is the actual appointment type itself. So this will actually select the event type that's going to be added to the appointment once it's created. So here is an example of a decision tree and how it's configured. So with our first box, that's what the user would see. That basically, in this example, just prompts them to schedule their visit. Once that's selected, the first question in this example the patient would see is, are you feeling sick? So based on that response, the user is going to get a series of answers. In our example here, if a user chooses to select other, they'll be prompted with the next question, which is asking, why do you need to be seen at our practice? There will be 3 options presented to the patient. So in this example, we have for a procedure, a flu shot, or for COVID testing. So depending on the option that the patient selects, they'll either be presented with the event type to schedule. So in our example of our procedure and our flu shot, and again, keep in mind this is a sample environment, so probably not the correct event types, but they would see that event type and then the appointment would go ahead and it would be scheduled. And then the yellow boxes beneath those event types, that will be the reason for visit that's attached to that appointment. So we will see that in the appointment details box in practice management, as well as that will display in the reason column of the appointment tab of the inbox on the EHR side. In this example, we have a third option, however, that doesn't lead to an event type, and that is for COVID testing. So this practice has decided that they would like patients to call instead of being able to self-schedule. So if they select COVID testing, they'll receive that blurb there in green, and basically just says, please call the office to schedule. And then, the patient would probably choose to end the scheduling process and call the practice. So based on that, configuration we just reviewed, patients are kind of guided through that predetermined workflow, really, with the end goal to help them choose the, appropriate appointment type for them. So the available appointments are then displayed for the patient, and that's determined based on the choices the patient has selected. So we mentioned for things like the location they chose, the resource, you can narrow it down by specialty, and then ultimately they would get the ability to choose the date and time that your practice has determined to make open for self-scheduling. So if configured, the patient will then complete that decision tree to select the event type. An additional option that can be added to the workflow is to include insurance information. So that will allow the patient to review and update that information as needed. I did want to point out that if a patient does go in and update those insurance details, it won't actually update the insurance in NextGen. So, won't actually change it or change the policy number, group number, things like that. Instead, what it does is the details of that change comes over on the appointment. So that can either be in the appointment details box or the appointment description, and that's dependent on your practice's setup. So like in this example, we could see that the patient had added that insurance and the group number and policy number that they added. And so then those details can be compared to what's already in the chart and then updated as needed. So now I'm going to turn over the webinar to Holland, and she's going to walk you through the next feature, which will show you how patients can manage their prescriptions in the portal.
Thank you, Lexi. So in the PXP portal, patients also have the ability to request a refill of an existing prescription, or they can also request a new medication. So a patient can request a new prescription on the portal based on a list of both their active and inactive medications from NextGen. In addition, medications can be manually searched using that drop-down in the Request a New Medication field. The pharmacy associated with the request can either be selected from a list or manually added by the patient. The list of pharmacies does not pull from file maintenance at this time. However, instead, the list is maintained in Site Generator. The patient won't see their default pharmacy from NextGen, but they will see any previously selected pharmacies from past refill requests. Requests for their prescription refills or new medication requests will be sent to the patient portal tab of the inbox based on the message routing rules that are configured in the PXP integration tool. So the practice can respond back to the patient with either an approval or denial. If it is approved, the medication will need to be documented and sent from the medication module. So another great time-saving feature of the PXP portal is the ability to create and distribute health forms. So these health forms can be utilized to collect clinical and financial details from the patient, as well as digitized forms such as consents or privacy notices. There are three main types of forms that can be configured for a practice. The first type is the general registration and health history form. And this form comes pre-built with the installation of the portal. The data from the general registration and health history form flows into NextGen as discrete data. And what that means is that the data can be added directly to the patient's demographics or clinical chart. So another option is custom patient forms. These forms can include questions, checkboxes, radio buttons, and even prompts for an electronic signature. The data from this form type will come into NextGen as a PDF that can then be reviewed and the data can be manually entered into the chart as needed. Our final option is the use of instant medical history, or the IMH forms. If you're not familiar, IMH forms use decision-based questionnaires to collect data. These forms are sent out to patients as an attachment to a portal message, and once completed, the information will come into NextGen as discrete data. I do want to note that this is an add-on feature that does require a separate purchase of the IMH product. So for the forms that come into NextGen as discrete data, the information can be reviewed by practice staff before updating the chart or demographics. This can be done in two main ways, with the first being to utilize the portal system practice template in the EHR. This template will show any changes in a red and allow a user to import or bypass any data. The other option is to use the PXP integration tool. This tool will also show forms that have been completed by a patient. There are two columns in this view, the current EHR data and the portal data, to be able to compare the changes that were made. With this option, users will also be able to import or bypass data as needed. So here's an example of viewing patient updates in the system practice template in the EHR. You can see that at the top of the form, the phrases in red prompt the user with which sections were updated and which need reviewed. In this example, we are reviewing a completed health form in the PXP integration tool. That first column there shows what is currently documented in the EHR, and the second column displays what was entered by the patient in the portal form. Like I said, each change can either be accepted or bypassed. So any configuration of custom forms is going to take place in that site generator under the forms section. The general registration and health history does come pre-built during installation. However, certain sections can be customized as needed. A practice can decide which sections will display, as well as apply filters for things such as age range, location, and provider to create several versions of the form as needed. So under that forms section, there's also where a practice would create completely custom forms that would mimic existing forms used by the practice. These forms can also have filters for things like age range, location, and provider. And the patient can be prompted for information needed through question boxes, answer lists, and consents that have e-signature functionality. So in this example here, this is a customized patient form, and you can see that a section for medications and allergies has been created. Questions can be created, and a list of acceptable answers can then be defined. So here is an example of the consent section that can be added to a custom form as well. The consent agreement title and statement can both be customized for the practice's needs, and as well, that e-signature option can be enabled. So this is the custom patient forms that come into NextGen as a PDF are going to be found under the categories tab of the patient history toolbar. And you will also be able to see a PDF copy of the general registration and health history form under that same tab. So now I'm going to pass it back over to Lexi, who's going to continue on the deep dive into the PXP portal.
All right, thank you, Holland. So continuing on, the next feature of the PXP portal that we're going to explore is the health record. So the health record is a tool that can really take, some administrative burden off, when a patient does require request records from the practice. So under that health record section of the PXP portal, patients can view as well as download what's referred to as their personal health record, or PHR. So this record is sent from NextGen kind of as a patient-friendly CCDA. There are several instances when that personal health record would be generated from NextGen. So the first is after the patient completes their enrollment in the PXP portal. So initially it will send that document that basically has a complete record of that patient's clinical data, what's been documented so far, to their patient portal account. The next scenario is when a clinical encounter is locked in the EHR. So after that visit documentation is completed and the encounter locks, it's going to trigger an update of that PHR, and that's going to be automatically sent to the patient, and they'll receive a notification when that record is updated. That personal health record can also be manually generated by the practice. So that can be done, whenever it's needed using the medical summary utility or that MSU. And then the final option is for the patient to request that updated health record, and they can actually do that without needing to go to the practice directly in their portal account. So our health record in the portal consists of any documented demographics, our clinical data, so things such as medications, allergies, as well as any visit-specific data. That visit data is updated on that personal health record automatically, like I mentioned, once that encounter for the visit is locked. Included in the health record is also any lab and radiology results. So the results will be sent to the portal along with that visit summary, as long as 2 criteria are met. The first is that the lab results have been received from the lab before the encounter locks, as well as those lab orders have to be, or results, excuse me, have to be signed off. So otherwise, if the results haven't come in yet in the encounter locks or they haven't been signed off on, there are a few options to manually send those results. So that can be done both from the orders module as well as from the PAQ. In the PAQ, there are several options that providers may be aware of for sending those results. So things such as action sets, as well as custom rules. So those can be set up to kind of help with making sure those results get to the patient. So here's an example, just a small snippet of that health record that is how the patient would see it in their portal account. So you can see at the top that as a patient, I can actually see the date and time that the summary was sent. So that can be helpful, to see how up to date it is, as well as there'll also be a list of past summaries. So if they did want to look back historically, they can do that as well. Basically, the patient would then just scroll through this document and they can review any updates that were made since last time they reviewed their summary. If a patient would like to download a copy of their health record, this can be completed within the portal as well. So that record is downloaded as a PDF, and the patient has a few options of what to do with that. So they can actually share that PDF with a direct address. So if you're not familiar with that, basically a direct address is for like another healthcare provider or different healthcare organization outside of your own. So they can even send it directly, or they also have the option to send it by standard email. Which, if that sounds concerning, considering this is PHI, there are warnings there, and the patient has to acknowledge that they are sending this through potentially an unsecured email. And patients even have the ability on this same screen to request an updated personal health record at any time. And what's nice is they don't have to reach out to your practice. They basically just click to have that summary generated, and then would automatically be sent by NextGen. So when that request is made and that's automatically sent to the patient, there is something important that I wanted to note, is that that document is sent with any of the data that's documented in the patient's chart at the time. So this could potentially include data from both locked and unlocked encounters, if any exist at the time that the request is being made. So just something to make you guys aware of. So obviously, while the concept of patients having access to their health data, at their fingertips at any time is exciting, I'm sure some of your minds are already kind of reeling with ways that, having all that data, readily accessible can go wrong. So there are a few options for that. And one of those solutions is the use of sensitive encounters. So if an encounter is marked as sensitive in the EHR, then an updated PHR would not automatically be sent when that encounter is locked. So that really can just help your practice to have a little more oversight. And you would still have the ability to manually send that update and include that information if you choose to. So to use this feature, you would just, the normal process for marking an encounter as sensitive in that patient history toolbar. Under sensitivity settings, you would want to make sure that you check off sensitive encounter, as well as that checkbox for suppress auto send to portal. So another great time-saving feature that a practice might enjoy here in the portal is the ability to allow patients to view statements as well as make payments directly from the portal without having to involve any billing staff. So this feature is referred to as NextGen Pay in our PXP portal. So when a patient is logged into their portal account, they will be able to see the current guarantor balance, as well as be able to view past statements, and then, like I said, make any payments. Payments through the portal can come from a few different sources. So the first is from the pay bill icon. So that's that first screenshot, and that's what's displayed to a patient when they're logged into their portal account. The second option is that second screenshot, which is what's called the Pay Here feature, and this is basically the option for a patient to pay a bill without having to log into their portal account. Another option is for practices to enter those portal payments on behalf of the patient. So that is done within the practice portal. And then finally, payments of things like balances as well as copays can come from the PreCheck process. And so we'll be covering that a little more in depth in a few slides. So regardless of the source of the payment, a transaction will automatically be added to a specific batch in the PM application. And then practices will have the ability to review those transactions, make any modifications before they're posted. So that workflow of handling those transactions is very similar to reconciling payments from the legacy portal. So if a practice does choose to enable the bill pay feature in Site Generator, patients will have the ability to make payments without logging into the portal account. The link to make a payment is accessed from the practice's portal login page. So through this option, the patient will enter all the required information. So, just some basics like the patient's name, date of birth, obviously their credit card information. There's a few other, options that can be set as required. And also a practice can decide if they want to set the account number as a required field. So this is something that if you're using Loginless, I would highly recommend because that's really going to prevent payments from being made that won't be able to be matched to a patient if there's not a valid account number. But if the patient has all that required information, it's completed, then the patient would submit that payment. As I mentioned, it would go into a batch in practice management. The other option is if a patient logs into their portal account before making the payment, they will be able to make the payment, obviously, but they will also be able to see any outstanding balances. Patients will also have the option to save, one or more credit cards. So they could save them in this portal and then be able to use those for future payments. The account number field on this window is read-only, just so you're aware. And basically that's just to help the patient identify the account the payment is going to, if they do have a statement in front of them. Once a payment is submitted from this screen, a receipt will automatically be emailed to the email associated with the account. But the patient will also have the opportunity to print a copy of the receipt or download it on the confirmation screen if they wish. And then additionally on this screen, patients will have the ability to see past payments that have been made on that payment history tab. In addition to making payments, statements are also supported in the PXP portal. So when a statement is available for viewing in the portal, the patient receives a secure message, notification to that email that their account is associated with. They can then log into their portal account and to view that statement. They also have the ability to view and download previous statements, and those would download as PDF documents. Patients will also have the ability, based on your practice settings, to choose the format in which they would like to receive statements. So they can choose to receive them electronically, paper statements, or even both. If your practice prefers not to give the option for both, you can disable that, as well as if you want to disable the option for paper statements as a whole and only give them the option of electronic, that's an option as well. So here's an example of what a patient would see when they log into their portal account to view a statement. So as I mentioned, they can come in here, they can preview that statement, as well as look at past statements, and then they can print or download that statement to their computer as well. Okay, and then we've come to our final PXP Portal feature that we're going to review today. And this is another add-on product, which is called NextGen PreCheck. So NextGen PreCheck is a feature that really can save yourself and patients a lot of time when you're going through that check-in process. So basically what PreCheck does is it gives the patients the opportunity to complete portions of the check-in process before they even arrive for their appointment. So one of the options that you can offer patients is the ability to confirm or cancel an appointment directly from the appointment confirmation email. Patients can also enter preferred pharmacy details, so that's one less thing to collect when they're in the office. A step can be added to ask patients to review or provide insurance information. So that can be manually added, or even the option to upload pictures of the insurance card. Registration and other custom forms can be provided to the patient, so that can help you gather some clinical demographic details before the patient even comes to the office. And then finally, co-pays and any outstanding balances can be paid during the pre-check process as well. So the pre-check process is configured on the appointment dashboard under the settings tab. So on the general tab, notifications for appointments can be enabled. So you have options for email, text, or even to have both notifications. Once that feature has been enabled, we can go to our second tab, which is notifications. And that is where our appointment confirmations and reminders can be previewed. So you can actually see the wording that's going out to your patients. As well as on that tab, we have the ability to set up the reminder frequency. So you can actually set that up to be in days, hours, or even minutes. So, we can set up multiple frequencies as well. So, for example, maybe we want a reminder to go out 3 days before the appointment and then 1 day before the appointment. And then the frequency of those confirmations and reminders can actually be configured separately for email as well as text notifications. If you want those to be kind of at a different cadence, that's an option. On the pre-check tab of the settings, there are different steps of the check-in process that can be enabled depending on your practice's needs. So for example, demographics can be enabled. So that's going to prompt the patient to review things like their personal information, contact information, as well as pharmacy. We also have the ability to enable an insurance form. So that is where that patient would be able to upload their insurance card images or even manually enter those insurance details. Enabling co-pays and balance will basically give the patient the ability to see any balances as well as make those payments before arriving for their appointment. And then finally, we have the option to enable forms, and that will display any configured forms for your practice during that workflow. So for example, if you have a consent form that you'd like them to complete, or some kind of health history, we can enable that here. And then we have, under the same appointment dashboard settings, we have a tab for forms where we can actually choose which form should be sent. So the process to review any changes or updates to the patient data during the pre-check process is pretty much identical as what we saw previously for our health forms. So the patient data that comes from these forms in pre-check will pull into NextGen as discrete data. So again, just that means that data can go directly into the chart. So for example, like updates to demographics. And they can be reviewed by your practice in 2 ways. So the first is that portal system practice template in the EHR. So again, you'd be able to review what changes were made and then choose to import or bypass that data. And then the second option is through that PXP integration tool. So again, you'd be able to review based on the 2 columns to see what's changed and then choose to import or bypass the data that came from the pre-check process. So as you can see, there are a ton of great features with this patient experience platform, patient portal, that really you and your patient population can leverage and help access health data and connecting with your practice. So now let's go ahead and get signed out of our portal so I can turn it over to Chelsea and she can explain how we can help your practice and then finally open it up for some questions.
Great, thank you so much, Lexi, and thank you, Helen, for presenting as well. And again, everybody, thank you for joining us. We have received a number of questions already, but we have plenty of time still, so feel free to ask more if you have them. You can ask them in the questions area of the webinar control panel, and we're just going to go through them in the order that we've received them. So first question, pay to ask a question. Does that mean patients are charged to ask a question in PXP?
It does, it's an option that you have as a practice. So yes, if you do want to charge a fee for patients to ask questions, you can do that. And then basically that whatever charge is set up would go into NextGen. So that's an option.
Okay, next question. Are the add-ons for an additional cost?
Yes, they are. So yeah, any features that I mentioned as add-ons would be additional. I would say to confirm exactly what that means for your practice, I would reach out to your account executives with NextGen, and they can give you, more specifics of what that means for your practice.
Thank you. Is the PSS add-on a separate cost? We're gonna have a number of similar questions here.
I'm sure. Yes, that is a separate cost. Typically, I should say, that's kind of a generalization. Again, checking with your account executive, or if you are one of our reseller clients, if you want to reach out and we can get you that information.
Okay, next question. Can the Spanish appointment scheduling be automated to the patient's preferred language?
So typically, I think you're mentioning where I mentioned that things can be in different languages. So it typically displays both options for the patient. So kind of regardless of their preferred language in NextGen, they would be able to see English and Spanish.
Okay, thank you. Next question. If you don't allow it to send unlocked encounters, is that considered information blocking?
That is the million-dollar question. So I will say that the answer originally, according to NextGen, was yes, potentially that could be considered information blocking. There are a lot of local and state laws that could change that answer. So to avoid giving any legal advice, I would say if you have a legal team in-house or someone that you can check with, but I would say that that is something that NextGen was concerned with, so that is why blocking those is not currently how it functions.
Okay, thank you. Next question. Is NextGen Pay an add-on?
NextGen Pay is an add-on feature, yes.
Perfect. Moving on. Are the statements that the patient can see on the portal the actual statements they received, or is it just a default template? We use NextGen EDI for statements and are using updated statement templates, not the NextGen default statements.
So that's a great question. So the statements would be what comes out of NextGen. So I would say yes, if you're using a customized form, it should be the same. So yeah, if you are sending the statements through EDI or you are mailing them, however it works, they would still receive both. So yeah, that's a great question.
Okay, thank you. Next one. Do the patients see any/all payments on their account or only those received via NextGen Pay?
So I think, assuming you're meaning the payment history tab, so that would be just those through NextGen Pay.
Lovely. Next question. And just so you know, we are almost through all of the questions. So if you have more, don't hesitate. We only got a couple left. Okay, for that fee charge, would that workflow go with the med record requests? Would that be workflow for charges?
I think if I'm understanding.
I think I read that wrong. Let me read it again. For that fee charge, would that workflow go with the med record requests? Wait. For the fee charge that workflow would go with the med charge requests, would that be workflow for charges?
Okay, I think if I'm understanding.
Russell, can you restate that question, please? And we will circle back to it.
All right.
Do you know if we need an ICS license to use the medical forms feature?
So no, these forms are completely separate from ICS. So yeah, that's a great question. So the forms are can be created directly within Site Generator. So yeah, they're separate features. So you would be able to complete those, and then those forms, either come in as discrete data, or even if they come in as a PDF, those go directly into the EHR. So yes, it is separate from document management.
Okay, and it looks like we have some clarification on that question before. Fee charge. Would medical record requests be a good example of the workflow that supports a potential charge?
Okay, so I understand the question now. Potentially, yeah. So it would, the fee is assigned to the question label. So if the patient is selecting, like if you do have a message label for like medical record requests, and the patients aren't choosing to do it themselves through the portal, yeah, then you could definitely attach a fee to that. So yep, and then you would follow just your same process. It would just kind of add that to that particular message label. So yeah, that could be
Okay,
a great example. Thank you, Russell.
next question. Is Pay Here extra or part of the upgrade?
So Pay Here, the login list, so that is part of the bill pay feature. So that is typically an add-on cost. There's some merchant costs with that. But again, I would just highly recommend that you discuss specifically with your account executive, or again, if you are one of our reseller clients, we could get you that information just to get the specific numbers for that.
Okay, and it looks like this may be our last question, but we'll hang on just in case more people are typing. PreCheck is extra. Is it through NextGen?
Yes, so it's an add-on feature, but it is completely a NextGen product. So I will say that the nice thing, if you were maybe considering it, there's a lot of other PreCheck companies out there. What's nice is it's completely integrated, and yes, it's fully a NextGen product. So everything integrates into your system, and the setup is all done through through NextGen tools. But yeah, that's a great question.
Okay, it looks like we got another great question here. How difficult is it to swap from NextMD to PXP?
So that is something that I can tell you that NextGen has been working incredibly hard to make very seamless. So there are a decent amount of tools that they've created to kind of, take apples to apples. So from NextMD to PXP Portal, like an example would be like the message routing rules. So if you did have, those set up previously, there are tools to then convert that to be, in the correct format for PXP Portal. To kind of make that process easier. So, and I would say that they continue to add on to those kind of conversion tools. So that is part of the kind of when you do go through, if you are transitioning to the new portal, they'll walk you through kind of all of those options, as well as that there's some other options to kind of automate the switch. Like for example, enrollment, you have the ability to send out, bulk enrollment for all of your NextMD patients to then, re-enroll in the PXP portal. That's like an example of a tool that they have. So yeah, a lot of options to kind of make that process and not have to kind of, recreate the wheel if it's not necessary.
Great, thank you for that. Another question. Did you say that you have to maintain a separate listing of pharmacies in Site Generator?
You do. So currently, and I say currently because like I said, NextGen is constantly working and they're constantly, adding and improving. But as it stands, the list of pharmacies does not pull from file maintenance. So as a practice, you have either the choice to create a list. So again, the downside to that being obviously you'd have to maintain that list separately, so within Site Generator, or you could allow patients to just free type. So for example, as a patient, I could put in, I want my prescription sent to CVS, and then it would require them to put in the phone number. And then as a practice, you'd be able to actually map that to the correct, CVS in that example. I will say, as far as having to, initially create that pharmacy list and maintain it, there is an import feature where you could, export your list from file maintenance as an Excel spreadsheet, and then import that into Site Generator. So it's not, you're not sitting there typing out, however many pharmacies. It does still require that import, and then obviously again to maintain that list, but that is an option as well. So depending on what your practice would prefer.
Okay, another question. Is NextGen Pay the only option for paying during PreCheck?
Yes, so that is to pay like payments and co-pays. Yes, that's the only option that's currently offered.
Okay, next one. What about patient enrollment to the PXP?
So enrollment can happen in a few ways. I would say it's a lot simpler than the NextMD portal, in my opinion. So as I mentioned, first, if you are transitioning over that bulk enrollment, if you choose to do that, so to kind of mass, send out that enrollment to all of your patients, that's an option. As well as any time that a new patient's created or demographics are updated, it will automatically enroll the patient. If that doesn't capture a patient, then when an appointment's created, it would automatically send the enrollment. As well as there is an Enroll Now link that was added to the patient information bar. And so it's very simple. It's as simple as literally just clicking Enroll Now, and then it will send off the invitation. So that's an option as well. So there's quite a few. One of the things I do want to point out with that is, which is a little different than the NextMD portal, is as it stands now, the email address field is required. So I know some practices in the past were using, tokens or printing out those sheets to get around if a patient didn't have an email address or didn't want to share it with the practice. So that's no longer going to be an option going forward. So just something to kind of, if you're planning on taking the portal, maybe go through and there's different reports you can run and things like that to verify you have email addresses, or maybe include it in the workflow. An appointment schedule or check-in just to verify that it's up to date. NextGen is working on allowing those invitations to be sent by text message, just so you're aware, but at this time, it's just email address.
Okay, another one here. Are these conversion tools an additional cost or part of the upgrade?
No, the conversion tools are all included in the upgrade. Yep, so that, yeah, wouldn't be an additional cost to use those.
Okay, lovely. Another one here. In the workflow inbox in EHR, can portal tasks be accepted by one user so multiple users are not working on the same task?
Yes, so it would have the functionality that if it's sent to like a work group, which is I'm assuming what you're meaning, yes, if one user accepts it, then it would remove it from others' inboxes so they're not working on the same task. But then they do also have the ability to then release those. So if a user had accepted it, get caught behind with something else, they can release that back to the group if they need to. But yes, that's definitely a feature.
Okay, and here's another one. So can you enter none in the email if the patient actually doesn't have one?
So you technically can. You can choose that NA, but that will not allow the invitation to be sent out. So again, that's why they're trying to incorporate as soon as they can the text message just to kind of catch those patients. But basically, if that field is empty, then nothing will be sent out. And as it stands, the only way to receive the invitation is through email. I will say one of the features that they kind of incorporated to kind of help with that is families can share an email address. So for example, maybe you have, parents and their children, they're all, patients at your practice, and maybe you get the mom's email address and then you want to use that to send enrollment invitations for, mom, dad, and brother and sister, you can do that. So families can share email addresses. Short of, if the patient doesn't have an email address or doesn't want to disclose it, at this time, there's really no workaround for that. But again, they are working on incorporating text message invitations in the future.
Okay, and it looks like this is going to be our last question, but if you have questions, actually, we're going to grab two more, and then that's the end. But if you have questions that we haven't had time to answer, you see both Lexi's and Howland's information up on the screen. You can feel free to reach out to them directly, or else you can always reply back to the email that I'll be sending with a link to the slides and the recording within the next week. So basically, any way you can get a hold of us, we're happy to help. So let's move on with these questions. Once a task has been accepted, if they release the task back into the group, can they still see it, or does it function the same as the inbox?
So if it's released back, it would just go back to the work group. So I'm assuming if you mean if the user who had accepted it and then released it, that yeah, they would still be able to see it, as well as they can add notes. So if there was, some follow-up that they wanted to happen but didn't get around to it, they could do that, and then that'd be visible to the whole task work group.
Okay, so last question. How easy is it to update an email address for a child as they age out into being an adult?
So yeah, that's actually a great question. There's a lot of features with like linked accounts and age out. So there is the ability to set as a practice age out rules. So that can automatically prompt when a patient reaches whatever the age of majority is in your state. So then in that case the access of the guardian would be terminated, and then the patient, as long as again that patient has an email address on file, then that invitation can be sent to that particular patient as well.
Okay, so thank you again, everybody, for joining us. As a reminder, you see the information up on the screen. Feel free to ask us any questions that occur to you. And thank you for joining us today. I hope you have a great rest of the day. And as we close out here, you're going to get prompted to take a really quick survey. I promise it's super quick. It's just to give us a feel for how we're doing on these webinars. So if you take just 2 seconds to answer it, it would really be helpful for us. So thank you very much, and have a great day.
Thank you, everyone.